Volgende deel ons so 'n bietjie fiksheidsraad om jou gemotiveerd te hou gedurende die wintermaande. Maar eers is dit tyd vir velsorg-inspirasie met ons vriende van Lamelle.
Rukia, it's very, very nice to meet you. And I look forward to hearing more about your story, but why don't you start us off by telling a bit more about yourself?
Ek is 'n haarkapster, ek woon in Mamaspree, getroud met 3 dogters. Ek is baie lief vir die buitelewe ook, so ek is baie in die son ook. En ek is so veronderstel om te wees met my lupus wat ek het.
So the condition, your medical condition and your work environment is something you feel might be affecting your skin.
Ja, definitief.
Well, tell us, what is your major concern?
Ek het pigmentasie begin kry en vel is baie onevenredig, plekke wat donker kolle het en donker kring om my oë.
Pigmentation and a special mention around the eyes of something that's happening to you. And I know you're on a very well thought out skincare program. How long have you been on a skincare program for your pigmentation?
3 years.
So 3 years of working on it, and have you seen any improvement?
Yes, a little bit.
Well, in terms of the hyperpigmentation, let's take a moment just to talk about something very common and I think very misunderstood when it comes to dark marks. And that is the dark area around the eye. Now, there are up to 11 different causes of dark discoloration around the eye. Another contributor that people often don't fully appreciate is that around the eye there are a lot of very small blood vessels. And because the skin is so thin, the sun causes those blood vessels to eventually, through damage, dilate. They become bigger. So you can actually see more of those fine blood vessels under the eye. They also look dark. So we tend to lean towards treatments that can work for pigment, for swelling, for blood vessels to try and keep them shrunk but smaller so that they're not as obvious. But there are still a large group of patients who still, despite these great therapies, still see a darkness. So in those cases, often what we do refer them for is a treatment that's done in a doctor's rooms. Some patients are able to get this done through professional skin facilities as well, where they inject with a tiny little needle carbon dioxide gas, believe it or not, just inside the skin. It's called carboxytherapy. And what this does under the eye is it helps thicken up that tissue, but also, more importantly, helps significantly reduce the inflammation and the swelling.
Okay.
But I really want to stress that this darkness around the eye can sometimes be very different from the pigmentation on the rest of your skin. So very important to realize that. So when we talk about the pigment of the face, that is relatively a little easier, believe it or not, because this pigmentation now is over time just because of sun exposure. Are you experiencing just individual spots or large areas of pigment?
Net individuele spots.
Okay, now that's important because I know that you have mentioned that you also have thyroid changes. Now, women who suffer from thyroid problems, be that high, usually low thyroid, these low thyroid function patients often have a pigment condition called melasma. The pigmentation very often you see in pregnancy or if women are taking the oral contraceptive pill, but very often women who have these conditions also have a thyroid disorder. So I'm glad that yours isn't melasma, but just sun-induced spots.
Okay.
If you use a brightening product on your face, consumers and yourself must recognize that when you apply a cream to the whole face, it's going to lighten all the skin, the unaffected skin and the dark spot. That is why we recommend exfoliation, but sometimes not exfoliation on the whole face, just on the dark spots.
Okay.
Because that encourages that skin to shed away a little bit faster and for that pigmentation in that area to come out quicker.
Okay.
So lots of really exciting ways that we can help you with these dark spots, with the marks, and hopefully your concern around your eyes is because of either blood vessels or pigment, because that we can fix. If we can't fix that, then as I explained, we might have to consider that other little treatment called carboxy, which also gives very, very good results for this exact same concern. Well, thank you very, very much for your time. I love chatting to you. I hope I've been able to share some interesting information with you, and I hope that you see great results with your treatment.
Baie, baie dankie, dokter.